Good morning to everyone. My name is Francesco Vito Mandarino, and I am a PhD student and gastroenterologist at the Gastroenterology and Endoscopy Unit of Serrafale Hospital in Milan, Italy. First of all, on behalf of all co-authors, I would like to express our gratitude to the editors of Gastrointestinal Endoscopy and to all the reviewers for considering and accepting our study titled Safety and Tolerability Outcomes of nonanesthesiologist-administered propofol via target-controlled infusion in routine gastrointestinal endoscopy. And I'm also thankful for the invitation to participate in this GI authors interview series. Performing gastrointestinal endoscopy under sedation is now standard care, primarily because sedation is associated with higher quality endoscopic examinations and improved patient comfort. Traditionally, sedation in GI endoscopy involved use of opioids and/or benzodiazepines. However, in recent years, there has been a shift toward using propofol. And propofol can be administered in various modalities, including the common incremental bolus method, patient-controlled sedation, and target-controlled infusion. The acronym is TCI. The TCI system uses a mathematical model to predict the drug's pharmacokinetics based on the patient's parametric factors and adjusts the infusion rate accordingly. This leads to more consistent and predictable sedation levels than the incremental bolus method. In this way, in other words, TCI reduces the risk of intermittent or accidental deep sedation, which can occur with manual boluses, and this ensures the patient's comfort and respiratory stability. At our department, TCI has been the standard method for sedating low-risk patients, classified as A score 1 and 2 since 2002. As background of the study, despite the evident benefits of TCI, we noted a lack of data on studies evaluating non-anesthesiologist-administered propofol via TCI for GI endoscopic procedures on large samples, more than 10,000 patients. So our study aimed to assess the rate of adverse events and evaluate patient satisfaction with non-anesthesiologist-administered propofol via TCI in our patient historical cohort. We enrolled ASA score 1 and 2 patients who underwent outpatient endoscopy procedures between May 2019 and November 2021. Data were collected respectively in our electronic reporting system, and subsequently they were abstracted at the time of data analysis. A brief description of endoscopic procedure and sedation setting. A specialized nurse solely responsible for monitoring the patient and not participating in the endoscopic procedure managed the sedation and under the endoscopist's supervision. A non-call anesthesiologist was available in the department in case of emergencies during procedures. And the concerning methods, patient satisfaction with sedation was assessed using a 100-point vision analog scale. Moving to the results, we enrolled 18,302 patients, 7,162 gastroscopies, and 11,140 colonoscopies in our study period. Regarding safety, in the overall cohort, we recorded adverse events in 240 procedures, 1.3% of the cohort. There were no significant differences between the gastroscopy and colonoscopy groups. It's important to note that all adverse events were transient and successfully managed by the gastroenterologist with no need for an anesthesiologist intervention. No major adverse events or deaths were recorded. Hypoxia was the most frequent complication with 143 events, 0.7% of the cohort, occurring mostly during colonoscopies compared to gastroscopies. Interestingly, in the multivariate analysis of the colonoscopy group, age was an independent factor for overall adverse events and hypoxia. Concerning satisfaction, the overall visual analog scale rating for sedation was 84.9, with no significant differences between the gastroscopy and colonoscopy cohorts. About 98.9% of patients indicated they would like to repeat the procedure with the same sedation protocol. So the results of our study confirmed that the administration of propofol via TCI managed by gastroenterologists is a safe and effective sedation method here in endoscopy. TCI allows for the continuous infusion of propofol, maintaining a steady and preset concentration of the sedative in the bloodstream or brain, resulting in a more consistent and controlled sedation level. TCI administration minimizes the risk of adverse events associated with the drug overdose. In our department, we continue to actively research further directions, and these include comparing this DCI protocol to the standard propofol bolus administration technique and working on the cost effectiveness of moderate sedation for low risk patients managed by gastroenterologists. Once again, on behalf of all co-authors, thank you for viewing this GI authors interview, and we strongly encourage you to access the full study and not sit in GI.